Thanks for coming in this morning. Can I get your name, please?
Sandy?
Great, Sandy. Thanks for coming in and talking with us this morning. We would like to share your story so you can get a little bit of an idea of some of the symptoms that you were feeling before coming into ProActive Spine Center.
Okay.
Tell us a little bit about what you were experiencing leading up to before coming in here.
I was having headaches in the back of the left side of my head here, extreme headaches.
Okay.
Even at night it would wake me up, and I had to take a ton of ibuprofen, and I'm not prone to headaches at all, so
Okay.
I knew something was wrong. So it lasted for about 2 weeks,
Okay.
and I went into my general doctor, and he stated that perhaps it was just a muscle issue. I just had some tense muscles that was giving me headaches, and he suggested going to get massages and gave me a muscle relaxer, which I didn't take at that point. So I did that for a week, and then it still hadn't gone away. So I went back to my general doctor and saw a different doctor this time at that practice, and he felt that perhaps it was arthritis. So he sent me to have an x-ray of my spine, and also stated to take the muscle relaxers also.
Okay.
So, and he said in 2 weeks I should be absolutely fine. So it started to diminish a little bit, the discomfort, and kind of went away, and it was manageable with ibuprofen, but I just knew it wasn't right that I still had to take aspirin all the time or ibuprofen constantly. So I was talking to a friend of mine, Carolyn, who comes here to your office, and I thought perhaps it's pinched nerves, and she said just go in to see you, and I did, and you said go get an MRI, and I went and had the MRI, and they discovered immediately that it was actually a tumor, a brain tumor. So I went in, and 6 days later I had surgery to have the brain tumor removed, and yeah, here I am today, healthy and happy.
That is so fantastic. I'm
So
glad that is your
thank God
absolute
you guys
outcome.
for, doing that was amazing.
Well,
So,
we
'cause
appreciate
everybody
that.
else just said to take muscle relaxers, kind of blew it off, and you actually took the time, and it was you cared, and that was so nice. So
Thank you for that.
Yeah,
We
no,
appreciate
thank
it.
you.
You're
You
very,
saved my
very,
life, so thank you.
very, very welcome.
Yeah.
Can I ask a couple questions about the type of headaches when you mentioned, like in the evenings when you were sleeping? What happened at night for you?
It was just like a constant throbbing in the back right over here, and then when I would lay down, it would wake me up, just a pounding. It was just a throbbing, pounding that I could not get away. It would help if I pressed down at the bottom of my neck a little bit, but it never went away. I would have to get up and take some more ibuprofen.
Okay.
It was just a constant pounding, throbbing pain.
Headache in the back. Okay.
Mhm.
Tell me a little bit after you guys got your diagnosis and they found out that you had a tumor, and they had stated that it was located in an area part of your brain for memory and other things, and then you started thinking back to some of the experiences you had that maybe you just pushed away as being stress or whatnot. Can you talk a little bit about some of the things you were telling me about?
Sure. Well, thinking back now, I actually could go back 4 years where I started having issues where little things would slip my mind. Like I would see a plum and I couldn't think of the name of the plum. Or,
Okay.
and at work I'm a flight attendant, so I'd have to write like the letter C for a Coke, and I couldn't remember how to form the letter C. But I was going through things at home, and I just thought perhaps it was just stress, and I kind of didn't think twice about it.
Yeah.
And so then, fast forward 4 years later, when it came down to it, right beforehand, before I went in, I pulled my car into the driveway, and I went to go turn it off, and I could not remember how to turn my car off. And my 9-year-old daughter, had to tell me, "Mom, just turn the key." And I was like, "Oh yeah," and then it would all click, but I couldn't remember how to do that. So a lot of memory issues, just little things that you just think, oh, it's just stress, oh, it's just this, and it actually was the tumor that was, my brain was swollen, and that's why I was having those memory issues.
Makes sense. Tell me a little bit, if you don't mind, about your procedure once they did the MRI with contrast and you went in. Tell me a little bit about what your stay was like and how long you were there and how your recovery's been.
When I had the MRI with the contrast, they sent me directly over to the hospital. And at that hospital, I saw the emergency room doctor, and she stated that they were going to send me over to Northwestern because they had better specialists over there to handle this tumor. So they took me by paramedic, and they sent me over to Northwestern, and I stayed there overnight, and then the doctor said that I could go home and scheduled the surgery for 3 days later, and I had the surgery 3 days later, and I only was in the hospital for 2.5 days.
That's
and I got to come home.
fantastic.
Yeah.
Great, wonderful. And recovery's been good for you as well?
It's been good. I mean, I don't have any feeling right here in my head. They said that will most likely come back. Perhaps not all of it, but a lot of it. But honestly, I feel fantastic.
Wonderful.
Yeah, things are coming back, and I'm remembering more now. So it's
That's
it's great.
fantastic.
Yeah, I'm very grateful.
Well, we thank you so much for coming and telling our story, and our goal is to, if there's anybody out there that has any symptoms
Yes,
similar to yours,
absolutely.
because things do happen, although they're rare, they do happen. We appreciate you sharing your story, and we're so glad that you're feeling so much better, and your health is much better as well.
Thank you. Thank
You
you
are-
again for caring. I appreciate that.
You are very welcome. Thank you, Sandy.